We're going to go over some different swallowing strategies. The reason I like to do this is one of the most concerning things with Parkinson's is what we call aspiration or aspiration pneumonia. This can occur when little bits of food or liquid go down the wrong way into your airway rather than going down into your stomach where it should be going. This happens due to a lot of different factors. Can happen from just overall generalized weakness, pharyngeal weakness of your throat. It can happen because of poor posture, and it can also be a cognitive piece too, where you might have more trouble attending to swallowing as you're eating and drinking. And this is just so important for our daily lives because eating and drinking is just one of our pleasures in life. And the longer we can continue to do that, the better. And being able to eat without coughing or choking is really vital to our daily health. So here are some strategies that we're going to be looking at that can help you to be a little bit more safe when you're swallowing. So number one, we already talked about, make sure to be sitting fully upright in a firm chair when eating or drinking. We don't want to be reclined on a couch. We don't want to be laying in bed trying to drink while we're kind of semi-reclined. Ideally, we would be sitting up nice and tall. The second thing, take your time and eat slowly. Make sure you have enough time for meals. A lot of times choking happens when you're rushing or when you go to talk, when you have something in your mouth and it just gets inhaled or sucked into your lungs. Has anybody had that happen before? I know I have. When you go to talk and a little bit of crumb or something gets in your throat, that is the worst. Number three, make sure you're taking small bites and chewing well. Sometimes it may be necessary to have what dietary modification, especially like in more advanced stage Parkinson's. You might need to make your food a little bit more soft or a little bit more moist. You might need to avoid really crunchy things or dry textures. Sometimes like little bits of rice or corn can be very challenging too. Yeah. And again, swallowing can vary a lot for people with Parkinson's. And I just, if you are having coughing or choking, I always recommend that you do like a one-on-one session with a speech therapist, just to get like a feel for what's going on. They can give you some really more specific recommendations. These are a little bit more general recommendations, but I like to share them with everybody. Again, make sure you're using that full attention when eating or drinking. If you can reduce those distractions, like turning off the TV, trying not to ask too many questions during a meal, or maybe you have a special time that you eat when you're on your own and then you talk while your partner's eating, that can also be a good strategy too. Avoid any dry, hard foods that tend to get stuck in your throat. And then brush your teeth often and rinse your mouth after meals. You always want to make sure you get that little bit of crumb that's like stuck down here in your teeth, because that can pose an aspiration risk later on, a delayed aspiration risk. Okay, now I'm going to teach you some exercises that you can do to help improve your swallow. And these are just some real basic strategies here. And a lot of these have been found in studies to benefit people with Parkinson's. So you can see here, and sure, this man has got that kind of that Parkinson's slump. He's sort of leaning over, he doesn't have really good posture. He's coming forward a little bit with his shoulders. So we want to kind of do the opposite of that. We want to bring our shoulders up and back. So let's try that. Everybody bring your shoulders up and back. And I'm going to move my scarf so you can see what I'm going to do. I'm going to make a double chin here by tucking my chin. So I've got that extra flap in my throat. That is called a chin tuck. So let's all try to do that double chin there. You can look at yourself in your camera if you have that available. And then we're going to do what's called a hard or effortful swallow. All right, everybody grab your water. Nice. I see, Kathleen, you're doing a really good job with that chin tuck. So we're going to tuck our chin. We'll take a little water, and then we're going to do a hard swallow. You might be able to hear yourself swallow if you're doing it really correctly and really loudly, effortfully. Make sure to squeeze the muscles in your throat. We have these constrictor muscles in our throat that go like this. The more we can squeeze, the more exercise they're going to get. Just like when we're exercising our arms and legs, our throats need that exercise too, especially as we get older. Let's try it again. So we're gonna do our effortful swallow. Tuck your chin. We're gonna swallow hard. This can be a really good strategy to use if something does go down the wrong way. First, you wanna cough it out, and then you can try doing that effortful swallow. And let's try another effortful swallow without any water. Let's tuck our chin and swallow hard. Good. And when we tuck our chin, we don't want to tuck like this. We want to tuck more like this, where we still have our posture. Excellent. Well done, everybody.